Imagine feeling utterly exhausted, a deep fatigue that no amount of rest can fix, coupled with a host of other debilitating symptoms. It is frustrating when you know something is wrong but cannot quite pinpoint what it is. When it comes to myalgic encephalomyelitis, also known as chronic fatigue syndrome, or ME/CFS, physicians confirm the diagnosis not through a single definitive test, but by carefully evaluating your symptoms against established criteria and ruling out other conditions. This approach helps ensure accuracy in identifying this complex illness. The reason for this careful process is that ME/CFS is a systemic illness affecting multiple body systems, and there is currently no specific biomarker or laboratory test to definitively identify it. Instead, the diagnosis relies on a comprehensive clinical assessment. Doctors look for a distinct pattern of symptoms that persist for a significant period, typically 6 months or longer, and significantly impact your daily life, after other potential causes have been thoroughly investigated and excluded. The first crucial step a physician takes is to rule out other medical conditions that could be causing similar symptoms. This often involves a series of physical examinations, blood tests, and sometimes imaging scans. They might check for thyroid disorders, anemia, sleep apnea, autoimmune diseases, or even certain infections. This investigative phase is vital because many conditions can mimic ME/CFS, and ruling them out ensures that your physician is focused on the correct underlying issue. Once other conditions are excluded, the physician will then focus on whether your symptoms align with the specific diagnostic criteria for ME/CFS. The cornerstone symptom is post-exertional malaise, or PEM. This means a worsening of symptoms after even minor physical or mental exertion, with the effects lasting 4 hours or even days. Beyond PEM, doctors look for significant reductions in activity level, unrefreshing sleep, and cognitive difficulties like brain fog. Other common symptoms they consider include orthostatic intolerance, meaning difficulty with upright posture, chronic pain, and immune system issues. These symptoms must have been present or recurrent for at least 6 consecutive months, and they must be new or have had a definite start, not lifelong. A key insider tip for patients is to meticulously document their symptoms, their severity, duration, and how they impact daily activities. This detailed symptom diary can provide invaluable information to your physician, helping them identify patterns and meet the specific criteria more easily. It is also important to remember that finding a physician knowledgeable about ME/CFS can be challenging, so perseverance in seeking the right medical support is crucial. The term diagnosis of exclusion does not mean it is a diagnosis of last resort or that your symptoms are not real. It simply describes the careful method used to arrive at an accurate diagnosis for a complex illness. Ultimately, receiving an ME/CFS diagnosis is a pivotal moment. It provides a name for your experience, offering validation and a path forward for management. While there is no cure, understanding the diagnosis allows you and your healthcare team to develop strategies to manage symptoms, improve quality of life, and learn how to pace your activities effectively. This structured diagnostic process helps ensure that you receive the most appropriate support for your unique health journey.